December 1995, the FDA approves a new prescription painkiller, 12 hours of pain relief with low risk of addiction. The science looks solid. The label says it's safe, but by 1996, it floods the market.
Doctors prescribed it freely, patients trusted it completely, and Wall Street celebrated it enthusiastically.
What public doesn't know is that the manufacturer already does. Early on, warning signs appear: abuse, dependence, overdoses. Internal reports reveal a growing problem. Not years later, not decades later, but from the very beginning. Children misuse it, families lose control, emergency rooms fail, and the company stays silent. This is the story of how profit eclipsed responsibility. How a prescription drug sparked a nationwide catastrophe, not with an explosion, but a slow, calculated collapse, measured in prescription return, profit, and lives lost. Let's rewind. Purdue Pharma was founded in 1892, which was then later purchased by the Sackler family in 1952. For decades, they had been in the business of medicine. But with OxyContin, they weren't just selling a drug. They were building an empire. When OxyContin launched, Purdue doubled their sales force to over 600 representatives and spent more than $200 million on expansion. These weren't ordinary salespeople. They were trained with one mission: convince doctors that OxyContin was different by being revolutionary, but importantly, safe. The pitch: less than 1% risk of addiction. Sales representatives focus on high opioid prescribers, cancer specialists, pain specialists, and crucially, primary care physicians. Sales increased from $48 million in the first year, nearly $1.1 billion by the year 2000. In late 1999, a physician named Dr. Art Van Zee in St. Charles, Virginia began seeing something terrifying. Young patients, good kids with bright futures, coming into his clinic addicted, overdosing, and dying. They were good kids with bright, promising futures, and this was all being hijacked by their development of opioid use disorder. Van Zee said, "It's hard to overstate the tragedy. This brought countless individuals, families, and communities." He wasn't alone. Across Appalachia, Virginia, West Virginia, Kentucky, entire towns started crumbling. Families shuttered, funeral homes couldn't keep up. And here is the thing. By 1999, nearly all new arrests for false prescription in Maryland had been written for OxyContin. 1 year later, overdoses were reported across the country. Baltimore, Boston, Denver, Detroit, Honolulu, Philadelphia, St. Louis, and Washington, D.C. The pattern was unmistakable, but Purdue company officials testified in Congress that they did not hear of any particular problem until early 2000, and that was entirely a lie. Internal documents show that as early as May 1996, just 5 months after OxyContin's approval, Richard Sackler and other executives were sent reports describing how drug abusers were crushing and injecting the pills. In early 1999, Purdue's General Counsel wrote about finding references to abuse our opioid products on the internet. That same year, company officials learned of a pharmacy call describing OxyContin as the hottest thing on the street. Forget Vicodin. They knew and they kept selling. Purdue continued their marketing OxyContin as less prone to abuse and addiction than other prescribed opioids. And they did it in the face of all this knowledge. While bodies piled up, a few voices refused to stay silent. Dr. Art Van Zee became an activist. He wrote papers, he testified. In 2001, he launched a petition type asking the FDA to pull OxyContin from the market. Purdue executive traveled to meet with Mr. Van Zee at the local advocates at the model in Virginia. They offered $100,000 to fund addiction treatment in the area. It looked generous, but it was an attempt to silence the opposition. Benzie and others refused the money. Then came the journalist. In 2001, New York Times reporter Barry Meyer began investigating OxyContin. His reporting uncovered evidence that Purdue was deliberately pushing the drug who had no business prescribing it. Meyer obtained internal documents showing that Purdue's best sales were happening in the areas with highest level of abuse. On May 10, 2007, Purdue Pharma pleaded guilty to a felony charge of illegally misbranding OxyContin and agreed to pay $600 million, which was approximately 90% of the profits during the offense period. Three executives, the company's president, top lawyers, and former chief medical officers also pled guilty to misbranding charges and agreed to pay a total $34.5 million in fine. People thought finally accountability. However, federal prosecutors had originally recommended felony charges against these executives. Instead, they were allowed to plead guilty to a single misdemeanor charge, and none of them served jail time. According to Dr. Art Benzie, the trajectory would have been completely different. It wouldn't have reached the magnitude that it did. The message to other pharmaceutical companies was clear. You can get away with it, and many of them did. Let's talk numbers. Between 1999 and 2022, approximately 727,000 individuals lost their lives due to the opioid overdoses. In 2022 alone, 110,000 drug overdoses occurred in the United States. Approximately 105,000 people died from the drug overdoses in 2023, with nearly 80,000 of those deaths involving opioids. Each number is a person, a son, a daughter, a parent, a friend, empty chair at the dinner tables, families that will never be whole again. The lawsuits didn't stop in 2007. Purdue Pharma pleaded guilty to 3 felony charges and agreed to pay over $8 billion in penalties, the largest ever levied against a pharmaceutical manufacturer. In 2019, Purdue filed for Chapter 11 bankruptcy protection. The Sackler family, who made billions from OxyContin, has faced lawsuits from states, cities, victims, and families. But here's the brutal truth. No amount of money brings back the dead. No settlement erases the pain. OxyContin's commercial success did not depend on the merits of the drug. Studies showed it offered no advantage over appropriate doses of the other potent opioids. It succeeded because of the aggressive marketing, deceptive claim, a system that values profit over people. The opioid crisis isn't over. In 2025, an estimate 210 people still die each day from drug overdoses. Dr. Benzie is still fighting, communities are still healing, families are still grieving. And the lesson, when corruptions put profit before human life, the cost is measured in graves. And this is the story of OxyContin, a miracle drug that became a national tragedy.